Hi, I'm Dr. Jeff Blank, and in this very short video of a complex procedure, I'm going to be going over a neuromuscular case that involves maxillary fixed ceramics. The entire upper arch will be done in fixed ceramics against a lower bonded orthotic. Our patient presents with basically AP or anterior posterior problems, pain, and a desire to actually replace these existing veneers with whiter teeth. In this particular case, we're doing things a little bit unorthodox in that I'm going to be cementing a lower lab processed bonded orthotic first, on which all the templates for preps and impressions were made. This is obviously seating the lower neuromuscular bonded orthotic at the tensed position and obviously at the proper AP vertical that we established preoperatively. This is the orthotic in place. And then, of course, once it's bonded, we're going to begin removing the veneers and prepping the teeth. We're finding numerous interproximal decayed areas that require breaking contact. Once the anterior teeth are prepped, we're going to use our prep guide to make sure that everything has enough reduction. And using the bite stent against the lower orthotic, we're going to be relining the neuromuscular bite stent in the anterior section where we've prepped the teeth. Of course, it is seated. And it's obviously very important to maintain the actual proper vertical throughout the procedure so the patient bites into this neuromuscular bite stent. And as you can see, we reline the stent as we go. The prep guide for posterior teeth, we're mainly increasing vertical in the posterior region, so minimal prep top hats are done. Of course, this is the patient's left side and it is seated. If you note that the second molar is not prepped, which is very important to leave that hard tissue stop to the bitter end, and we're not going to prep either of the second molars. Of course, that is removed, and as you can see, we begin doing the patient's right side. Again, minimal preparations, had some crowns that were removed that obviously had an existing vertical. But once we get that done, we can now prep the second molars. Very important not to actually connect the wash material of the second molar to the first molar so that we don't have any kind of overlap, and it just assures that we maintain our bite. And again, in this picture, we're going to be showing obviously prepping the very last tooth, which would be tooth number 15. And again, not allowing the wash material to come in contact with the previous material just to assure that we have a proper neuromuscular bite. Of course, here you can see that everything is basically not connected. You can see, and we're going to head right into obviously a final impression. This is Aquasil heavy body with a XLV wash. Then, of course, we're going to actually put some glue on the teeth and do a shrink wrap upper provisional. This is a neuromuscular bite stent made against the lower orthotic, not bite stent, I'm sorry, provisional stent. We put Luxatemp inside of it, and of course it is removed, and we always like to see minimal flash, as you can see here. Any residual flash that we have, we just go through obviously with a fine diamond and just barely remove that provisional material. And as you can see, the final product, what we have is a very nice, good-looking provisional against the lower bonded orthotic. The lingual cusps of the maxillary teeth are the only thing that come in contact, and again, there, of course, is the lower orthotic in place. Here's our patient's smile, and again, obviously wanting to generate good aesthetics and a good final outcome.